Hi, this is the third and final module in the motivational interviewing component of this course. My name is Aaron Greenblatt. I'm an assistant professor in the departments of psychiatry and family medicine here at University of Maryland School of Medicine. So this lecture focuses on the processes and skills of motivational interviewing, particularly the evoking and planning processes, and describes some of the skills that we can use to move these processes along. As before, based primarily, although not wholly, on the work of Miller and Rolnick, as bookish pictured here. So evoking and planning are the kind of third and fourth steps of motivational interviewing of this conversational style that we're describing, which is a way of working with people who are feeling ambivalent about behavior change. Here's the multiple choice question for this module. So what is not an MI consistent way to respond when a patient describes reasons for continuing a maladaptive behavior? A, provide a simple reflection of their sustained talk to see if they may respond with change talk. B, reflect their sustained talk and also mention a reason for change they have brought up earlier. C, make an even stronger argument for their sustained talk. D, point out that they have probably lost control of their behavior. Or E, take a step back and explore the patient's goals and values. Again, what is not an MI consistent way to respond? D, point out that they have probably lost control of their behavior. All these other options actually are consistent with motivational interviewing. D is correct because it's not MI consistent. Reinforcing the patient's autonomy and self-efficacy are key to effecting change, not pointing out that people have lost control of their autonomy and no longer have self-efficacy. A is incorrect because it describes simple reflection, a response to sustained talk that can evoke change talk. And again, I'm saying incorrect here, but they are correct ways to respond. B is incorrect. It's consistent with motivational interviewing because it describes another technique, double-sided reflection, which uses the word "and" to link sustained talk and change talk. C is consistent with motivational interviewing because it describes amplified reflection, a response to sustained talk that, again, can evoke change talk. And E is incorrect. That's to say, it is consistent with motivational interviewing because exploring goals and values are useful in the engaging, focusing, and evoking stages of motivational interviewing. So the evoking process is where motivational interviewing really starts to be motivational interviewing. Engaging and focusing are common to many things in medicine and many things in behavioral health. The evoking process, getting patients to describe their own reasons for change, is fundamental to motivational interviewing and is key to helping patients navigate their ambivalence. The evoking process really, central to the evoking process are techniques to guide people into voicing pro-change arguments, not only in terms of reasons, but also in terms of importance. Recall that people can talk themselves into change by continually voicing pro-change arguments. And this has been shown in study after study after study that talking about change means that people are more likely to enact that change. So what is change talk? As we mentioned before, there is a mnemonic for this, darn cat. And this is a slightly arbitrary way of categorizing different kinds of change talk. So if people start to talk about their desire to change, their ability to change, reasons they should change, or their need to change, they're engaging in preparatory change talk, but the mnemonic darn. And if they start to talk about how they're really committed to change, how they have taken steps to start to move towards that change, or they're getting activated. They're getting ready to take that change. That's what we call mobilizing change talk, the mnemonic CAT. So we now have some skills to get to people to talk about change. And in order to encourage this, we need to recognize it when we hear it so we can water it and fertilize it. So how do we evoke change talk? It really means returning to those core skills, the open questions, affirmations, reflections, and summarization. It means providing, asking questions, providing reflections, and offering affirmations for which the natural response on the patient's part is change talk. Put differently, we got to ask questions where the answer is change talk and avoid questions, for the most part, where the answer is sustained talk. So while Miller and Rolnick very specifically say that motivational interviewing is not a way of tricking people into change, I have to admit that evoking change talk with certain techniques sometimes feels a little tricky. And I have to admit also that I find that fun. And this is one of the reasons that motivational interviewing is satisfying to do, because you can get with just a handful of tools, you can find yourself having conversations or evoking conversations in patients where they're really talking about things that they haven't talked about before. So here are some of those tricks. I'm going to review rulers, querying extremes, looking forward, and exploring goals and values to identify discrepancies. The importance ruler is an oldie but a goodie. You show them literally, you can show them a picture of a ruler, or you can just describe it theoretically. But once someone has, for example, identified a given goal, in this case, if the patient's goal is to change their substance use, you could have them say, on a scale of 1 to 10, where 1 is not at all important and 10 is extremely important, I want you to circle or identify how important is it for you to change your substance use. And you ask the person to mark something there. If they marked 0, then you actually need to return to that engaging and focusing part, because you haven't identified a goal that is actually important to the patient. But you're doing this in the evoking process, and in the evoking process, just as a reminder, on the travel metaphor is you've already decided to travel together. You've already decided where and when, and now you're describing the reasons that you're going to go and have. So, on a scale of 1 to 10, how important is it for you to change your substance use? They mark down some number, usually between 2 and 10. And the key here is to say, why is this not a lower number? So if they say 5, maybe that sounds like it's not that important to them. If you say, okay, so you marked down 5, thanks for letting me know, isn't this a 1? They would say they're gonna naturally respond with the reasons that number is higher than a 1. So they'll start telling you about the reasons it is important to change their substance use. This is kind of opposite to the typical helping person's writing reflex, which would be they mark down 5 and you say, what do you mean it's just a 5? Why isn't it a 9? If you ask somebody in this situation why it's not a 9, they're going to tell you all the reasons that it's not important to change their substance use, the reasons that that number is relatively low. And so that wouldn't be the right motivational interviewing move, because you would just be evoking sustained talk. And we're trying to get the person to evoke change talk, or to express change talk, rather. Some of the other kinds of questions that we can imagine asking with this importance ruler would be questions like, what would make it a 10? That kind of makes the person do a little bit of problem solving. Well, what would make this more important? What could make, not only why is it more important than one, but how could it become a nine? What are some of the things that could move it towards a nine? Again, that's going to describe the things that are motivating the person to change. Again, evoking change shock on their part. Another question that you could ask in this situation is, if something would make you change, what would it be? It's hypothetical, but it's going to put them in the position of answering with change talk and not sustained talk. The opposite of that question will be, why aren't you changing? Because I like it, because it's comfortable, I'm familiar with it. You're going to evoke sustained talk in that case. So if something would make you change, what would it be? I labeled this slide the importance ruler, but this ruler can be used with confidence and readiness as well. How confident, now that you have decided that this is important, how confident are you that you can make this change? Again, let's say their answer is a 4. So it sounds like you have some confidence. What makes you a 4 instead of a 1 on that confidence ruler? What are some of the things that's making you feel confident that you can change? What would make you have more confidence? Again, this gives people an opportunity to problem solve and think about their process of change. Querying extremes is another fun technique you can use, especially if there's scant initial motivation. Maybe with the person who comes in and says, I'm gonna stop smoking when they put the last nail in my coffin. So one way of kind of asking this is, what is the worst possible thing that might happen if you don't X, make this change? Or if you were completely successful in changing, how might things look? You think about it, the answer to both of these questions is some form of change shock, or at least hopefully it's going to be some form of change shock. And if it's not, then the wonderful thing about this is that side effects are very minimal. You can always change direction. You can always take a step back, re-engage, refocus, make sure that you're talking about the right problem. But if you ask, what's the worst thing that might happen if you don't make this change? People are going to describe reasons that they should make a change. And if you were completely successful, again, planting the seed that this change would be a success, people are going to start describing a situation in which they've moved on to a situation that is that they're happier with. Looking forward is another fun technique that we kind of brushed on when we talked about the hypothetical with the importance ruler. This question comes out something like, if you decide to make this change, how would things look? How would you have accomplished it? So it puts people in the future kind of looking. So you mentioned that you've had some struggles with quitting smoking, and yet you're finding it increasingly important. Looking, a year from now, let's say that you've made this change, and you've been successful. Looking back, how do you think you would have done it? Or what do you think will be the things that make it possible for you to successfully make this change? If we end up in that situation, the person starts to describe the processes that they are going to need to successfully implement the change. So exploring goals and values is another time-tested technique that is useful in both the focusing and the evoking stages. So in the focusing stage, exploring a person's goals or values, fundamentally getting to know them as a human being in this world, will help us identify their goals for change. And in the evoking process, once we've identified their goals for change, we can use the goals and values that we've identified for the person as a way of developing discrepancy, or as Miller and Rolnick call it, instilling discrepancy, letting it come in drip by drip to start to make them feel like there's an increasing tension or discomfort between their current behavior and their goals or values. So as an example, if you understand that somebody's values include always showing up on time, punctuality. And they also identify their substance use as something that gets in the way of their being punctual. You can then, then they're going to recognize that they substance cessation as a goal and something that will help them live up to the values that they themselves have expressed as central to their identity. Again, exploring goals and values is always going to make people feel heard. It's always going to make people feel that you are actually coming alongside them in the spirit of motivational interviewing to guide them to the solution that they themselves want to find. So talking kind of more specifically about some of the tools that we can, ways that we can use reflection. Again, this is a very, very fundamental processes in motivational interviewing, fundamental skills in motivational interviewing, and also one of the most fun and satisfying things that you can do when you're having conversations about change. So there's a bunch of different kinds of reflections that I can describe here. The first, or simplest, is straight reflection. Straight reflection can result in change talk. And when this happens, which it frequently does, you'll be surprised, or you may feel really satisfied by how easy it is. So as an example, patient says to you, "I'm doing the best I can. What more do you want?" Straight reflection would be something like, "It seems unreasonable to look at other things you could be doing when you're already working so hard to change." So the answer may be something like, "Well, it doesn't really seem unreasonable to look at other things. Of course I should be looking at other things because I can always work harder." All you did was essentially agree with the person or reflect back to them using this second person singular pronoun, you. You're already working so hard to change, and it seems unreasonable to look at other things. Person, essentially, you're continuing the paragraph, and they're going to respond with some changed. Another reflection technique is double-sided reflection, where you reflect their sustained talk and then use the word "and" to link it with previous change talk. So an example in this situation would be somebody who says to you, "I'm fine now. I don't need to go for any counseling." And you say something like, "On the other hand, things are going well. And yet, your family is still pretty concerned." Putting that previous change talk, "my family is concerned," second, so that the person can continue the paragraph. "Yes, my family is concerned. I think they have a point." Amplified reflection is it's kind of what it sounds like. So, for example, "Your drug use is pretty much exactly where you want it to be." It may elicit some disagreement in the direction of change talk. For example, a patient that says to you, "I don't like taking artificial medications. Weed is natural." You could say, "Taking medications has never done anything to help your symptoms." So the natural argument with your statement is, "Well, of course, medications has helped my symptoms." And so you're able to instill some discrepancy between the person's beliefs about medications and what their statements and current behaviors are. Another one of my favorite techniques, agreeing with a twist, as Miller and Raleigh call it. So imagine someone saying, "I can't imagine myself quitting heroin." So you agree with them, you reflect back, and you amplify. And you take it in a direction that is in conflict with their own goals or values. "I can't imagine myself quitting heroin." You just wouldn't be you without it. It's so important to you that you may just have to keep using no matter what the cost. can hear the natural response to that is, well, no, I can't keep using no matter what the cost. And all of a sudden you've by agreeing with the twist, I guess you're never going to quit using no matter how many bad things happen to you. Well, of course I'm going to quit using. So now you've evoked some sustained talk. I mean, you've evoked some change talk and avoided the sustained talk that they initially presented with. So, as people have sustained talk, or which can sometimes be categorized, or which is often erroneously categorized as resistance, but which is just a natural part of a conversation with somebody who feels ambivalent about change. You can emphasize autonomy without sarcasm. For example, I don't need medication because I'm not sick now. Much better. This is your decision in the end, regardless of what I and others are recommending. So in this beautiful example, the doctor is, again, reminding the person that they have recommended something. But again, emphasizing autonomy, having autonomy support. Another technique that I feel like is overemphasized in many presentations about motivational interviewing is the so-called running head start. So the idea with the running head start is that you're hearing out the sustained talk first before pivoting to the downsides of the status quo and the advantages of change. You hear about this pretty commonly as it is a way to engage with the patient, although it's a little bit counterintuitive because it evokes sustained talk. But I guess the idea is that you're starting with the sustained talk and then pivoting to reasons to the change talk. It's a shortcut in some ways to kind of shortcuts the engaging and focusing parts of motivational interviewing. All of your engaging has to do with being a non-judgmental listener about the person's reasons for continuing this maladaptive behavior. You've already decided where the focus is, essentially in a rapid primary care visit, for example, but you're able to use a non-judgmental conversation about someone's continued, unhealthy behavior as a way to engage them and then pivot in the direction of change talk. So, this is, in general, dealing with sustained talk and evoking change talk in the face of sustained talk is kind of also known as rolling with resistance. It's like a martial art where you're using the client's momentum to your own advantage. And it's always key, as we kind of started with, to not push against resistance. If you push against resistance, you're going to meet with more sustained talk. So we've reviewed briefly the idea of instilling discrepancy, but discrepancy is a way of starting to build people's ambivalence, and clients for whom ambivalence is barely there, and whom it's really unclear what their motivation to change is. There's a way to explore values and goals, honor autonomy, exchange information, and just get a little bit of ambivalence into the conversation and into the patient's descriptions of their own feelings. In this case, it's important to remember that when you're instilling discrepancy, the goal is not to end up at the end of the day with a plan to quit or a plan to change the behavior. The goal is really to instill some ambivalence so that in future conversations, either with you or another clinician, the person will have something to grab onto, will have something to move towards when it comes to change. So resistance or sustained talk really is a problem with to be overcome and to be engaged with in the evoking process. Discord can be thought of as another form of resistance. Discord is not about the person's relationship to their change process, but about their relationship to you as their clinician. The key is to respond in a collaborative, accepting way that honors autonomy and does not invite defense of the status quo. There's literally hundreds of ways to do this well, but the responses are similar to those for sustained talk. Refocusing on engagement, refocusing on a values and goals conversation, making sure the person knows that you can come alongside them. You're there to listen with that quiet curiosity about what moves them, what motivates them, and using this empathic engagement, this way of experiencing the patient's inner life as if it were your own, without ever losing that as if quality. Something that's important to mention is that we've talked about reasons to change, but instilling self-confidence and confidence that you can change is also key to this motivational interviewing process. Self-confidence is a belief in you, a belief that you are able, that you have value. Self-efficacy is slightly different, is a belief that I can get something done. And if you use an affirmative stance, using these affirmative statements, that client will kind of start to experience this self-fulfilling prophecy. You believe they can do it, they're going to believe they can do it, and you're really reinforcing this self-efficacy. Even if people think that they need to change, they're not going to commit to it unless they think it's possible. And the idea here is that these affirmative statements, this process of evocation can evoke not only reasons for change, but confidence for change. And again, if we think about a simple tool to use it, we can think about using that importance ruler as a confidence ruler. What are the kinds of things that are going to make you feel confident that you can make this change? What are some of the things that you were effective in changing in the past? What obstacles have you overcome already? Describe some of your strengths to me. What kinds of things are you good at? What are you able to do? And with those, with information about that person's self-concept in hand, you can really help people feel confident that they can have the self-efficacy to make these changes that you're talking about. It all feels like talk. And really what we've done so far is talking about reasons to change, confidence to change, and aspirations to change. Sooner or later, it's time to make a plan. You can't rush it though. So if you try to develop a change plan before the client is sufficiently ready, you may undo whatever process you've made through these engaging, focusing, and evoking stages of motivational interviewing. But eventually we get to the planning process. You're hearing increased change talk, darn cats, especially these commitment activation and taking steps, or mobilizing change talk rather. You're hearing diminished sustained talk, increased motivation and resolve, people talking about envisioning statements, imagining what it's going to be like once they have effected this change, and asking questions about how to make the change. Really, really good signs that it's time to make the change. Important to say that if you seize on tentative change talk, especially in the darn category, and then push for a firm commitment, set a quick date today, that person is likely to back away. Don't get ahead of your highest level of readiness. Instead, continue evoking attention, securing commitment, and then we're going to talk about this final summary bouquet. So this big summary bouquet at the end is a way of linking together all of your conversations with the patient about change. So you can talk about reasons to change. You can talk about their confidence to change, their ability to change. You can talk about how they have overcome other obstacles in the past, linking together their goals and values, the discrepancy that their goals and values have with their current behavior, and all of the change talk that they have brought up themselves, all of the reasons to change, all the confidence to change. And you put it together in a beautiful summary bouquet. And then what do? You ask an open question about the plan. This open question is something like, would it make sense to consider how we might take these next steps towards effecting this change? Or even better, where does all this leave you? Or just a statement, I wonder what you might decide to do. Then you got to wait, because the plan is not coming from you. The plan is coming from the patient. At this point, you've had an opportunity to provide and elicit that this person has had an opportunity to know what their treatment options are, or their options for behavior change are. And so you just give them an opportunity to tell you what the plan is. And at this point, you can almost always just implement the plan that they come up with. And that is the best plan, because that's the one that they are committed to and feel confident that they will be able to complete. Obviously, that's not the end of the story. People continue to change. And during the change process itself, even after people have decided to make a change, we need to continue these core skills of motivational interviewing. What next? What now? What else? What an amazing job you're doing. You're really succeeding. Or just reflecting back, really coming alongside this person to help them in their process of change. If it's almost invariably true that we're going to need to remind the person, refocus them at their goals, re-engage them if they start to disengage or we start to experience discord. But wonderful thing about motivational interviewing is that we always have an opportunity to change direction, to take a step back, and to use our creativity to be a person's guide throughout the change process. So with the final mnemonics that you may encounter in your board taking, I'd like to conclude this talk on motivational interviewing, and appreciate your tuning in. Thanks very much.